Jannelle.
Is not available. Record your message after the tone. When you've finished, you can hang up or press 1 for more options.
Hi, this is Jeffrey Thomas Bodin, Bodin, date of birth 05/22/97. I'm calling in regards to new requests that need to be made. Had some serious issues with Oshner's neurology today, their West Bank neurology. So I need y'all to start looking into finding me a neurologist who will prescribe my epilepsy medicine, since they are just blatantly refusing, and want to change me over to some other alternative clinic. So they canceled my appointment next Monday that I have had, and that means there's going to be like months that I will potentially not have my epilepsy medication again, and I don't feel like that's a very confidence gaining thing to stay with Oshner for that. I mean, I'll take the appointment if they do get me in with whatever other thing they claim that they're going to do. They just haven't done it yet, and there's just no reason for them not to establish with me, write a prescription, and then get me into that thing they were talking about, which will be months out, because that's just how that is. So if y'all want to call them, you're more than welcome to. Maybe you can work something out and explain the circumstances from Aetna's point of view to them. That might be appropriate. Their direct is 1-504-595-8318. That's 1-504-595-8318, I believe. 504-595-8318. Yes, that's the number they were calling me on today and previously. So, and my appointment with them was for October 1st at 8 a.m. And maybe you guys should touch base with them for canceling a patient's appointment for a pretty unreasonable reason, as they probably already got prior authorized funded for it. I know transportation was scheduled and already locked in and picked up by a provider, so people probably already gotten paid. It's just, that's just not reasonable at all. And whatever expedites my appointments so that I no longer have to keep looking for a neurologist again and again and again, to just write a prescription that's already been established for my epilepsy. And I spoke with this doctor last week when she called me about it, and she seemed to be plenty competent to handle it, but decided today that she changed her mind. And I don't know who changed her mind, or who spoke with her, or who might need to be spoken with their legal department, with Aetna. Maybe y'all could reassure them about that her regaining her confidence in treating me is a good idea. Things like that. It's, I think, appropriate. Because it's probably going to affect all the other Aetna patients as well. As not being capable of writing a prescription for me with one of the most commonly written epilepsy medicines sounds like it's going to be a problem for a lot of other patients. So that's kind of a priority, just in case they can just keep the appointment. And because that is next week, and I'm not canceling transit until I see that, the night before. Just because I'm just going to handle it that way. Just in case y'all can change their minds on anything. Because it's just not acceptable at all. And if y'all could also put on for looking for services for me, some sort of dermatology solution, because my current dermatologist is having difficulties with, I guess, acquiring documentation from any neurologist or anything that would be sufficient to allow them to proceed forward with a procedure, which they wanted to do, like laser hair removal, and alleviate some of these, issues I'm having with scarring and irritating previously excised malignancies on my face for shaving and things and cutting myself because of that. I do have epilepsy, not having epilepsy medicine and shaving and stuff. It's obviously it's not a good combination. And they were trying to work on that, but I also want to have some alternatives going on in the background. So if you could find me anyone who's able to just provide the laser hair removal in a surgical context, I think is what were aiming for with this dermatologist, was referring me to a surgeon to do such a thing, because it is necessary for these excised areas that they're already watching for melanoma, and it would just reduce irritation and bacterial infections that I keep constantly having issues with, probably just due to my immune system and my cancer. So I don't know what exactly would be who y'all would look for that, but y'all already found me a dermatologist, but I probably need whoever she was going to refer me to. So whoever that might be, because they didn't tell me, I don't think, and I don't want to continue to be waiting on that at all. That needs to just happen. Even if it has to be a surgical procedure with anesthesia, if they're that concerned about the procedure itself inducing seizures, which I'm not them. I don't, they might be too overly cautious. They might just have zero information from any neurologist at this point, because there is no one's accepting to communicate with them or anyone. So I don't know how to gauge if they're being overly cautious or exactly correct in the level of precautions that they're taking. I'm not exactly certain, but I'm not opposed to it just being an anesthetized procedure. So you could look for surgery options potentially that have anesthesiology for outpatient procedures, if Aetna's ever covered something like that before, like prior to another major surgery, patient goes in and has I don't remember what it was, like gamma radiation or something right before surgery, to target a smaller to a larger area, and they do it under anesthesia. I mean, because I've had it done for both my major surgeries for cancer around the site, so that they were gonna put the incisions, and they were very, very large sites. So I kind of have an idea of what they may have been talking about, but they could have been talking about an entirely different procedure. But I'm fine with that, even if it requires anesthesia to do so. It's just not a big deal at all. I am totally fine with that. I just need it to happen, and to get it done. I want it done within a month, because there's no reason to be waiting. And having this constant delay with neurology means that I don't believe neurology is going to satisfy any requirements that any other physician might be having on just wanting to communicate with any neurologist. They seem to just completely fail at any reasonable requests that are definitely within their purview and education to handle. I might not be very good at communicating those requests, but I think I did an okay job. Enough for them to not want to see me as a patient and try to get me somewhere else. So probably an okay job. If you have any other questions about those two things, you can call me back anytime like usual. I don't really have anything in writing, like forms or anything I can give you, but I don't think I'm going to be able to get anything from my dermatologist explicitly, because it sounded like they had to talk, either get me to have something presented to them, or, which I did try to already get from the neurologist I was trying to see next week, or like I was asked to do by derm, and if that's not a thing that really exists, then then both physicians would have to talk with each other, and that's a very difficult thing to set up entirely. And Aetna could probably alleviate that by just finding the procedure and getting me into that directly, and not doing this whole bouncing around referral thing, since the referral is not necessary for a covered procedure that's related to surgery or oncology or anything like that, or previous history of surgeries, familial history of scarring, severe scarring, or other conditions that are already being handled by Aetna, like my epilepsy, which all very clearly interact. So there should be zero issues with coverageability because of that, and no one's expressed any issues like that with me either. I don't think this is for being coverageability. It's like a precaution or a more information that whoever's doing the procedure might need, but they also may feel confident enough not to need it. I just haven't been able to speak with them or figure out how to schedule with anyone, or even like what to look for. And I need y'all to handle that part of things. I also saw long-term personal care LDH assessor today at 11 a.m. on 2025-09-22 for my initial assessment, like I had spoken with you on the 4th? Was it the 4th? Yeah, 4th. And also the 17th with your colleague about the rescheduled from last week's 15th to today at 11 a.m. from last week's 8 a.m. to 12 p.m. It was rescheduled to today for 11 a.m. I have completed the assessment. However, I don't know if you have followed up with the Healthy Soul Food Kitchen people or the CEO for that, if that was the Healthy Soul Food Kitchen CEO that we spoke with when you contacted them in front of me on the 4th. But even when I expressed that to the assessor today, who seemed to have a lot of experience with this type of thing, she made sure to make it clear that like they don't do food through their long-term personal care. Sounds like they're going to assign me someone, and so I need Aetna to probably definitely make the Healthy Food Soul Kitchen people a Medicaid contractor or whatnot, like you were talking about with me and with her, as soon as possible, if Aetna could do that. I know it's been a few weeks, but y'all might be able to pick up a contractor pretty fast now that LDH has definitely expressed that that's not them. That might have to be y'all, and this worker may be able to somehow help, but there is a list of contractors that I am supposed to apparently physically call myself. So I think I'm gonna just email you both of these documents, like the previous letter I got for the actual low set determination and the scheduled time initial appointment for the LDH, and then you see the St. Tammany Parish bases people that they employ by contract or something. Apparently each and every one I have to contact to discuss directly to them about what they might be able to do for me or might not, and it's entirely up to them, because I guess some of them might specialize or not specialize depending on what they require from their employees. So I have zero experience speaking to any of them. I've never heard of any of them, and I don't know which one we would be working with best. So I believe you have far more experience and exposure to them, and this is the list that I have right now is apparently going to be the list for my acceptance letter for long-term personal care that I'll receive in about 10 days. And so you can probably, through Aetna, or using Aetna as like the authority and stuff, call all of them and probably initiate some sort of a contract acquisition with them just in case. because I don't know how many of them are going to be able to help me. Or I'm sure that'll extend to other patients, because apparently I will not be receiving any case management from the state of Louisiana for long-term personal care services, but it sounds as though you and the nurse that you're working with that are both on my case for Aetna are my actual case managers, basically. Maybe not case managers under Aetna or Medicaid's terminology, but underneath like the Louisiana Department of Health, Aging Adult Services terms. It sounds as though y'all are either above that or at least equivalent to that, so I might be in a better position than most. And it that y'all should be able to sufficiently handle and coordinate this part. And if y'all have any issues with that, or anything you need me to do, or like need to set up another in-person appointment so you can physically see these, or have any other paperwork or anything, and that just might be easier like it was earlier this month, I'm very happy to do that whenever y'all believe that that is appropriate. But then I just want to get things set up fast. If you guys want to wait until I get the official letter in the mail, they said it would be 10 days, but I was basically told to start calling these people today, and I didn't, and it's almost midnight. And I probably won't on my own, because it's probably just too much for me to handle, and I just have no idea like how to sort through this at all. But I have a feeling you've probably spoken to all these people at least before, and will likely know, or one of your coworkers will, who exactly to go with for me based off of what y'all know for my case working with me. So I'm gonna send that to y'all tonight, and then if y'all could work on the neurology component and the dermatology component for the laser or like radiation based hair removal for my face and areas around scars, and for previous malignancies, if y'all could also handle that and touch base with me on it, I would really appreciate that. Thank y'all. You can call me back at 985-272-8989 for my mobile, or 985-520-4713 for till I leave a voicemail or something. Bye.